Good afternoon, everyone. In light of the governor's announcement yesterday around the lifting of the state stay-at-home order tomorrow, I felt it necessary to address the residents of Baltimore City. I have been monitoring this situation daily, and I don't feel comfortable sending residents, including young children and older adults, back out into the public at this time. Today, I'm announcing that Baltimore City will keep its local stay-at-home order in effect at this time. Baltimore City's reopening will be guided by the data and science. That is the only way we can responsibly tell residents that it is safe for them to return to normal activities even while maintaining social distancing. This decision has been made after close consultation with our public health experts. This means that all residents are required to remain at home unless they have to go out for essential job or tasks. Baltimore City is simply not in a position to safely reopen at this time. To get there, we must significantly increase testing capacity in order to meet guidelines established by public health experts. To date, the state has failed to provide local jurisdictions, including Baltimore City, with the testing resources we need to be able to safely reopen. I very much like to reopen, but until the state steps up to the plate and provide us with testing help, it would be irresponsible for us to relax our restrictions. Based on Baltimore City's population, World Health Organization guidance would indicate roughly 2,700 to 2,800 tests should be completed per day. We're not there yet. Daily testing volume changes on a weekly basis with less testing occurring on weekends. For the weekly cycle from April the 27th through May the 3rd, an average of 488 tests per day were conducted among city residents. For the weekly cycle from May the 4th through May 10th, the most recent full cycle, the average number of tests conducted per day was 571. And to date, all testing resources have come from the city of Baltimore and our local hospitals. So as you can see, there's a large disparity between where we are at currently and where the CDC guidance is recommending we be at to reopen safely. While we remain optimistic that the state will at some point be able to help with our testing capacity, the simple truth is that we need more tests to safely reopen the city of Baltimore. I absolutely want to be able to open churches and retail establishments, but the state has a responsibility in this too. Without more testing capacity, it will be irresponsible to begin the reopening process. We need the state to provide more tests and testing capacity to us. We also need to see a sustained decrease in cases and deaths. So far, the number of cases and deaths have continued to increase. We cannot lift the stay-at-home order until these increases stop, and that's one of the reasons why we are not going to lift our restrictions at this time. Now I will ask our health commissioner to come up and speak more about our process and what we are looking at for how to safely reopen Baltimore City.
Good afternoon. Thank you, Mayor Young, for your leadership on this. Yesterday, Governor Hogan announced that he will be lifting the stay-at-home executive order across the state as of Friday evening at 5 p.m., moving to a safer at-home model that allows for some businesses to reopen. Importantly, the governor acknowledged that not all jurisdictions in Maryland have seen the same levels of reduction in COVID-19 cases, hospital bed usage, and fatalities, or have had access to enough PPE. Therefore, individual jurisdictions have the opportunity to determine their next steps at the local level. Based on our COVID-19 surveillance data, Baltimore has not yet met the requirements for us to consider immediately lifting the Baltimore City stay-at-home order. Today, we saw an increase of 29 positive cases reported out, bringing our case total to 3,505. We've recorded 6 new fatalities today, bringing our total to 183 COVID-19 related deaths. We have still only tested about 3.5% of the city's population. I would like to take some time this afternoon to specify what trends in our testing capacity and contact tracing efforts we would need to see locally in order to lift our stay-at-home order. We do not make these decisions lightly, and the health of our residents remains the highest priority of the entire city government. I am very grateful to Mayor Young for his leadership and support on this. We would need to meet the following criteria in order to safely lift the stay-at-home order. First, accurate community transmission data requires Baltimore City to have access to adequate testing. This means that we have enough test kits that we are able to test anyone who's symptomatic, and also includes access to testing for our frontline healthcare workers or anyone deemed appropriate for testing by the health department due to their profession or living arrangements. Extrapolating testing needs from the World Health Organization, Baltimore City would need to see approximately 2,700 to 2,800 tests per day and a COVID-19 positivity rate of less than 10%. We are currently averaging 571 tests per day, and our current positivity rate is 21%. In the past few weeks, the city has opened 3 community-based testing sites, and we are moving forward with plans for mobile testing units in neighborhoods across the city. However, the fact remains that not enough tests have been made available to Baltimore City, a situation shared by many other Maryland jurisdictions. Until we have received more test kits from the state, it is very difficult to gather the accurate information necessary to plan for a safe reopening of the city. Additionally, to consider lifting Baltimore City's stay-at-home order, our contact tracing efforts need to see full participation from Baltimore City residents. For this to occur, we need your help. Right now, contact tracers from the Baltimore City Health Department and the Maryland Department of Health are in the process of reaching out to residents who have tested positive for COVID-19. They're reaching out to ask about their movements during the time they were able to spread disease and to ask them about the people they may have been in close contact with. Our team is reporting that some residents are choosing not to answer the call or refusing to provide the information being asked. It is necessary both for the safety of our residents and for the eventual reopening of the city that residents who've received these calls take them very seriously. Please answer the phone when you get the contact tracing calls. Please answer the questions honestly and be sure to provide the information that our contact tracers are asking for. These calls are confidential, and we would never ask residents for their social security number, credit card information, or immigration status. Again, I cannot stress enough, contact tracing remains the best tool the health department has in the absence of a COVID-19 vaccine to reduce the further spread of disease, and we cannot be successful unless residents are taking these calls seriously. We've already seen that some countries who reopened too early have had to quickly reinstate stay-at-home orders due to new outbreaks of COVID-19. Here in Baltimore, we cannot afford to make the mistake of opening up too early without proper testing capacity and contact tracing efforts in place. Any eventual reopening will likely see a spike of positive COVID-19 cases, but we need to ensure that when that happens, our city is ready to respond. Our leadership is in constant communication with the state to increase our test kit and PPE supply. It is vital that every single resident continues to follow the mayor's stay-at-home order and stays home unless for an essential reason. It is necessary for every single resident to continue practicing social distancing, continue wearing face cloth coverings in public settings, and provide the necessary information to our contact tracers if you are contacted. All of us working together is what will allow for the city to safely move forward and lift our stay-at-home order. Thank you.
Thank you, Dr. DeVasa, and thank you for all of your staff at the Health Department for the work and dedication to our residents. Next, I will ask our CEO of Baltimore City Public Schools to come up and talk about what this means for our students as it relates to the end of the year activities and summer school.
Thank you, Mayor Young. Baltimore City Schools supports Mayor Young in the determination to continue exercising an abundance of caution to protect the health and well-being of Baltimore's families. Following the instructions of State Superintendent Karen Salmon, all city schools buildings will remain closed for the balance of the current school year. It is important to note that distance learning is still continuing. So school is still in session through distance learning through the end of the academic school year. But we do want to encourage all families to continue to look for announcements about the exact date for closure. All city schools personnel whose duties do not require them to work on site will continue to work from home. Any staff members whose duties require that they be on site, such as meal site workers and volunteers and custodians, will continue to observe all social distancing procedures, including the use of appropriate PPE. We are developing guidance for the safe pickup of personal items at schools by students, families, and school staff, as well as the drop-off of school materials in line with appropriate social distancing. This guidance will be available on Monday. We are currently planning for virtual graduation by school for seniors in the period from June 10th to June 17th. But in the meantime, we will be celebrating their success through citywide virtual events like the Citywide Senior Spirit Week every day next week, along with many other events at the district and school level in the weeks to come. And as soon as is healthy and possible, we will, in the coming months, look for the opportunity to continue and have in-person graduations, again, as in accordance with the directive from Mayor Young and our City Health Commissioner, Dr. DeRaza. City schools will continue to work closely with Mayor Young and his team, along with all city and state agencies, to remain focused on the health and safety of our staff, our students, and their families as our #1 priority. Thank you.
Thank you, Dr. Santelises, and thank you to all of our educational professionals for keeping our young people engaged during this virtual learning period. At this time, we'll take a few questions.
Mayor Young, you mentioned needing more tests. Is that something that the city could require on its own? If not, why?
We have acquired some on our own, and along with our local hospitals, but the state has an obligation to all of the citizens of the state of Maryland. I'll let Dr. DeRosa come and speak to that.
Yeah, I would echo what Mayor Young said. So our community-based testing sites involve tests that we've acquired or that our healthcare partners that we're partnering with belong to them.
And to clarify, we're talking about test the swab, not the laboratory kits that the governor's office obtained.
Both. So all of it is things that we've purchased, or again, we're working with LifeReg at our Pimlico site, the swab as well as the reagent, all the materials. Last question.
I'm still running the city.
And Mayor Young, if not May 15th, then when?
Well, we're going to follow the advice, like I've always said, of our health professionals. And we're going to look at this weekly. And once we get the testing kits that we need to make sure that our residents are tested, then we can think about when we're going to reopen.
Mayor Young, what position has this order from the governor put local jurisdictions in, where now it's different county executives making the decisions as part of a more regional approach?
Well, a lot of county executives are doing different things. However, Baltimore City is my responsibility for the life and safety of the citizens of Baltimore. And my approach right now is, until we see less, deaths in the city of Baltimore, until we get the testing kits that we need to test our people, then we're not going to lift the stay-at-home order. I mean, it's my responsibility.
Are you concerned that in jurisdictions where restrictions have been more relaxed, city residents could go there, bring the virus back? Is that something
We're
you're
very concerned about that, and I've mentioned that.
What are you doing to try and limit that spread?
Well, I can't stop people from getting in their cars going anywhere. I mean, that's the problem. The reason why we all should be doing the same thing. But I know each jurisdiction have different, things that's going on there. But Baltimore City, I have to take the responsibility. And I don't want no deaths to be on my hands.
Dr. DeRaza yesterday asked this question at his news conference about providing test kits and capacity to the local jurisdictions. He said they're never going to go to the local jurisdictions, they're going to go to labs. What is the problem with the deployment of this particular test kit?
So, I mean, I think at least from our standpoint, we are in the community performing the tests. So for us, it would be helpful to have access to testing so that we can perform more at the community-based support sites that we're currently supporting, the mobile testing that we're expanding to. We need to have actual test kits to be able to perform the test.
What does the health department tell you when you're on calls with them, the state health department, in terms of access to this supply?
Yeah, so I mean, I think all jurisdictions, again, have asked similar questions. For some time, I know we were waiting for the test to be validated, but I think all jurisdictions kind of have a similar question or in the same position where we all need additional access to testing.
All right, thank you, guys. Thank you.